All right, today we're talking about something that I get asked about all the time. That's nerve blocks and nerve surgery. Your doctor just told you that it's your last option. You've tried everything else and you're so desperate that you don't even care what it costs. You don't care what the risks are, or if you have to do it every 2 weeks for the rest of your life. You just want the pain to stop. I get it. I've been there. I know what that desperation feeling feels like. But before you schedule that procedure, I need you to understand what you're actually signing up for. Because what your doctor isn't telling you is that nerve blocks and nerve surgery, they're not the solution. They are a band-aid, and band-aids don't heal bullet wounds. So today we're going to break down what nerve blocks and nerve surgery actually are, why doctors recommend them, the risk and side effects that nobody's talking about, and why they're temporary solutions, not permanent ones, and what actually heals migraines at the root cause. All right, so picture this. You're sitting in your neurologist's office. You've tried every medication that they've thrown at you, right? You've done the Imitrex, the Nurtec, Maxalt, Ubrelvy, Topamax, Aimovig, Emgality, on and on and on. And they worked for a little while, and then they stopped. Or they weren't working as well. They didn't last as long. So then you tried the Botox. You did multiple rounds, thousands of dollars. Maybe insurance covered some, helped a little, not enough. You've seen the chiropractors, the physical therapists. You've done the elimination diets. Let's cut out gluten, dairy, soy, sugar, caffeine, alcohol, citrus, everything else in the world. And you've spent the money. You've lost years of your life. Missed kids' birthday parties, best friends' weddings, promotion that you worked so hard for, that vacation that you've been supposed to be going on for the last 5 years. So you're desperate. And your neurologist says, there's one more thing we can try: nerve blocks or maybe even surgery. And you probably don't even ask a lot of questions, do you? You don't ask about the risks. You don't ask about the side effects. You don't ask about the success rate. You just say, when can we do it? Because at this point, you don't care. You don't care what it costs. You don't care what the risks are. You don't care if you have to do it every 2 weeks for the rest of your life. You just want the pain to stop. I understand. I have been there. My team understands. They have been there. But before you sign that consent form, I need you to understand what you're actually agreeing to. Because what your doctor isn't telling you could change your decision. So let's break this down so it makes sense. A nerve block is an injection of numbing medication, usually an anesthetic like lidocaine, and sometimes steroids. And it gets injected into specific nerves that are believed to be contributing to your migraine pain. The most common types are occipital nerve blocks, and this is where they inject into the greater and lesser occipital nerves at the base of your skull. This is used for migraines that kind of start in the back of your head and neck, and they typically, they'll do these injections like every 4 to 12 weeks. Then the trigeminal nerve blocks, this is where they inject into the branches of the trigeminal nerve around your forehead, your temples, your cheek. And this is used for more of that frontal or facial migraine. And this is also done about every 4 to 12 weeks. And then you've got ganglion blocks. And this is an injection into the nerve bundles behind your nose. This is used a little bit more for cluster headaches and sometimes migraines, but typically more cluster headaches. And this one can be done more frequently. So that's what a nerve block is. It is numbing the nerve, temporarily blocking the pain signal. Now, nerve surgery, also called nerve decompression surgery or peripheral nerve surgery, this is a surgical procedure where a surgeon either decompresses the nerves by removing tissue, muscle, blood vessels, bone, those things that are compressing the nerve, or severs the nerve completely to stop pain signals from reaching the brain, or sometimes even implant neurostimulators that block pain signals. Now, common surgical approaches include this frontal trigger site surgery, the decompression of nerves around the forehead, or temporal trigger site surgery, decompression of nerves around the temple, or occipital trigger site surgery, decompression of the nerves at the base of your skull, or like nasal trigger site surgery, removing tissue around the nasal septum. This is actual surgery, anesthesia, incision, recovery time, potential complications. This is not a simple injection. So why are doctors recommending nerve blocks and surgery? Because they're out of options. They have tried all the medications in their toolkit. They've done the Botox with you. They've referred you to specialists possibly, and you're still suffering. So they move to interventional procedures because it's the only thing left in their training. But here's what they're not trained in: root cause inflammation, gut healing, hormone balancing, nervous system regulation, toxic load reduction, autoimmune protocols. They're trained in symptom management. And when symptom management fails, they move to nerve interruption. Not because it heals you, but because it's all they know. Now, this is not a criticism on your doctor. It is just a fact about their training. Medical school doesn't teach root cause healing. It teaches symptom management. So when symptoms can't be managed with medication, they move to the procedure. And here's what I need you to understand about that. Nerve blocks and nerve surgery do not address why you're getting migraines. They do address the pain signal. They numb the nerve, they decompress the nerve, they sever the nerve, but they don't touch the root cause. Your gut's still inflamed. Your hormones are still imbalanced. Your nervous system is still stuck in fight or flight. Your toxic load is still overwhelming your liver. Your autoimmune system, if you have autoimmunity, is still attacking your body. The inflammation network that's creating your migraine is still active. So what happens? With the nerve blocks, they work for a few weeks. If you're lucky, a few months. Then the inflammation builds back up and the pain returns. So you get another injection and another for the rest of your life. It's because you're not stopping the reason that the inflammation's coming in the first place. You do that block and it blocks the pain, right? But then the inflammation just keeps building back up again. So here we go in this vicious cycle. It works for a while. Some people get reliefs for months or even a year, but the migraines come back. Sometimes in a different location, sometimes the same location. And it's because the root cause was never addressed. So I want you to think about it this way. Imagine your house is on fire. The nerve block is like muting the fire alarm. The alarm stops blaring, but the fire is still burning. And eventually the fire gets so big that you can't ignore it anymore, even with the alarm muted. Nerve surgery is like ripping out the fire alarm completely. Now you can't hear it at all, but the fire, it's still burning. And now you don't even have a warning system. Neither one puts out the fire, and that's the problem. So let me just ask you something quick. What are you actually looking for? Are you looking for a temporary relief that requires injections every few weeks for the rest of your life? Are you looking for a surgery that might work for a year but could leave you with permanent nerve damage? Or are you actually looking for freedom? The kind where migraines don't come back, the kind where you don't need procedures, injections, or surgeries to manage pain. The kind where your body actually heals. Now, if you want temporary relief, nerve blocks might be for you. Or if right now you are in so much pain and you are ready to get to the root cause, but you need a little relief, nerve block might be for you. But if you want permanent freedom, you need to address the root cause. So what does that actually look like? Let me walk you through the 4-phase blueprint that actually can get to the root of chronic migraines. So phase 1, you remove the inflammatory inducers. We remove what's actively inflaming your body. So it could be inflammatory foods creating gut inflammation. Could be toxins in your environment, products, medications, those kind of things. It could be inflammatory lifestyle habits, poor sleep, chronic stress, sedentary behavior. When you work on these inducers, it takes pressure off of the whole system, including the nerves your doctor wants to block or cut. Now, phase 2, we work on healing those chronic drivers. We address what's been driving inflammation for years. Gut healing, because 70% of your immune system is in your gut. And gut inflammation creates systemic inflammation, including nerve inflammation. We take a look at hormone imbalancing, because hormone imbalances dysregulate every system in your body, including pain pathways. We look at nervous system regulation, because when you're stuck in fight or flight, inflammation stays high and pain sensitivity increases. And autoimmunity at present, because autoimmune inflammation affects everything, including nerve sensitivity. And then we move on to phase 3, where we are addressing genetic switches. We look at your unique genetic predisposition and support your body's specific needs. Things like MTHFR, detox pathways, inflammation genes. And then phase 4, the transformation. We build in practices that keep inflammation low and your body resilient so migraines don't come back. This is what heals migraines permanently. Not by numbing nerves, not by cutting nerves, by removing the inflammation that's irritating the nerves in the first place. That's the difference between Band-Aid and healing. Now, I go into this 4-phase approach in depth in my free training. It's called The 3 Hidden Reasons Migraines Still Ruin Your Plans and How to Stop Them. The link's in the show notes. If you want to understand this more deeply, go watch that training. All right, let's talk a little bit of specifics before we finish up. If you are considering nerve blocks, here's what you need to know. You might get temporary pain relief, weeks, months, days, and it can help identify which nerves are involved. It's a non-surgical outpatient. You can go home the same day. It can be repeated. It may reduce your medication use temporarily, but here are the risks and side effects. Injection site pain and bruising. Infection risk. Anytime you break the skin, there's infection risk. Nerve damage from the infection itself. Yes, the thing meant to help your nerve can damage your nerve. Bleeding, especially if you're on blood thinners. Allergic reaction to the anesthetic or steroid. Temporary numbness in unexpected areas. Dizziness or fainting. Increased pain. Yes, it can make things worse. It's called a paradoxical reaction. And if they're using steroids, which most do, you get steroid side effects. Weight gain, mood change, elevated blood sugar, and bone loss with repeated injections. It's not a permanent solution. You would need ongoing injections. And effectiveness often decreases over time. The more you do them, the less they work. Typically, cost is between $500 to $2,000 per injection, multiple times a year, every year for the rest of your life. Some might be covered under insurance, not all is. And your insurance coverage may require pre-authorization. After a certain amount, they may decide not to cover it anymore, and you might end up paying out of pocket. It doesn't address root cause. The inflammation will continue, and you kind of become dependent. You become dependent on the injections to function. There was someone who told me a couple weeks ago that it was like, yeah, every 2 weeks. I'm working on, working up to every 3 weeks, every 4 weeks. But if you don't get to the root of the problem, you're going to be right back to the 2 weeks again. All right, now let's talk surgery. Potential benefits can be longer lasting relief than nerve blocks, right? You might get months to years instead of weeks. It may reduce migraine frequency and severity. It can address specific trigger sites. And some studies show 50 to 80% of patients report improvement. It's a one-time procedure, unlike ongoing injections. But here are the risks and side effects. Permanent nerve damage, numbness, tingling, altered sensation that never goes away. Infection, surgical site infection can be serious. Bleeding and hematoma, scarring, internal and external. nerve pain that's worse than before the surgery. There's anesthesia risks, allergic reaction, breathing problems, complications. Recovery time can be weeks to months depending on the procedure. And failed surgery, 30 to 50% see no improvement or worsening. 30 to 50%. You could have new trigger sites. Your migraines move to a different location. There could be chronic post-surgical pain, loss of scalp sensation, permanent in some cases, hair loss at the incision site, cosmetic changes, visible scarring. And the long-term consideration is it's not reversible. Once nerves are cut, they're cut. You can't undo it. And the migraines, they typically return because root cause wasn't addressed. This can cost you somewhere between $10,000 and $30,000 or more, depending on the procedure. And insurance coverage, often considered experimental and not covered. You might be paying out of pocket. There is very limited long-term data. We don't know what happens 10 to 20 years post-surgery. This may complicate future treatments too. Scar tissue can make other interventions difficult. And it doesn't address systemic inflammation. The fire's still burning. Now, most neurologists and surgeons, they won't mention number one, success rates are lower than advertised. Studies report improvement in 50 to 80% of patients, but improvement doesn't mean migraine-free. It often means migraine frequency reduces from 20 per month to 15 per month. Pain intensity reduces from 8 to 10 to 6 to 10. And it often means able to reduce medication slightly. That's not freedom. That's still suffering. Number two, many patients need repeat procedures. Even successful surgeries often require additional procedures within 1 to 2 years because the root cause inflammation is still active. Number three, there are no long-term studies. Most studies follow patients for 6 to 12 months post-procedure. We don't know what happens 5, 10, 15 years later. We don't know if nerve damage worsens over time. We don't know if migraines return at higher intensity. You're the experiment. And number four, alternative approaches exist. Most neurologists and surgeons are not trained in functional medicine, root cause inflammation protocols, gut-brain axis healing, nervous system regulation, or autoimmune approaches. So they don't offer them. Not because they don't work, but because they don't know about them. So before you schedule that nerve block surgery, ask yourself, am I okay with temporary relief that requires ongoing procedures? Or do I want that actual freedom where migraines don't come back? Now, if you want temporary relief and you're okay with the risks, then nerve block or surgery might be right for you. But if you want permanent freedom, if you want to address the why your nerves are inflamed in the first place, if you want to heal the root cause so you don't need injections or surgeries, then you need a different approach. Here's what I've seen after working with thousands of women. The ones who get lasting freedom aren't the ones doing nerve blocks or surgery. They're the ones addressing the inflammation network that's irritating the nerves. Because when you heal gut inflammation, so your immune system calms down, when you balance hormones, so pain pathways regulate, when you calm your nervous system, so you're not in constant fight or flight, when you reduce your toxic load so your liver can function, and when you address autoimmunity at present, your nerves stop being inflamed. Your pain pathways calm down. Your migraines stop. Not because you blocked the signal, but because you removed the source. All right, friend, here's what I want you to take away from this today. I'm not here to tell you that nerve blocks or surgery are wrong. I'm not. For some people, in some situations, they provide relief. But I am here to tell you that they're not your only option. And they're definitely not a permanent solution. You deserve to know that before you make a decision. You deserve to know that there's an approach that addresses why your nerves are inflamed in the first place. You deserve to know that healing is possible, not just management, actual healing. So the question is, are you ready to do the work to get there? If you are, I do have two things for you. So first, I want you to watch my free training, The 3 Hidden Reasons Migraines Still Ruin Your Plan and How to Stop Them. I break down the 4-phase blueprint in detail. The link's in the show notes. Just go grab it. And second, book a free migraine breakthrough assessment. For 45 minutes, we look at your specific inflammation pathways and figure out what's keeping you stuck. And the link for that's also in the show notes. So stop settling for Band-Aids. Start healing the root cause. You deserve to be free.